the topic of my presentation today is Immune Misfire, the global impact of IgE-mediated food allergies. Let me first introduce myself. My name is Kshreya Arora, and I was born in Tampa, Florida. I spent the first few years of my life in Minneapolis, and now I currently reside in East Lyme, Connecticut. One interesting fun fact about these places is that the summers in Florida are very hot versus Minnesota winters, which are brutal. Connecticut is my happy moderate. I'm a rising senior at East Lyme High School, and I have participated in multiple summer programs at different universities focusing on cellular biology, medicine, public health, etc. Being allergic to eggs, I'm highly engaged with this topic and therefore currently drafting a manuscript on food allergies with specific focus on the egg allergy. I have also participated in science outreach programs and facilitated fundamental science experiments at the elementary and middle schools in my town. I'm associated with a non-profit local organization called Sangam since the last 12 years of my life, and I have been nominated as the youngest sponsor for it. I have also obtained the President's Volunteer Service Award in 2022 and nominated for it again in 2025. This is the outline of my presentation today. I will go through the background of food allergies and what is the global impact. I will then dive deep into IgE-mediated food allergies, talking about mechanism of action, symptoms, and what is the current treatment regime, specifically talking about oral immunotherapy and Xolair injections. And finally, I will go through key take-home messages, references, and acknowledgements. Let's start with the introduction. The term allergy was coined in 1906 by an Australian pediatrician and scientist. However, as per literature, food allergy is defined as an adverse health effect resulting from a specific immune response that occurs reproducibly on exposure to a given food. There are two types of food allergies, IgE-mediated and non-IgE-mediated. For today's discussion, we will focus on IgE-mediated food allergies. From a global impact perspective, around 200 to 250 million people globally suffer from food allergies. Recently, there was a study conducted on 47,000 children and 45,000 adults between October 2022 to February 2023. The key allergens that were most prevalent in the study were peanuts, milk, and dairy products, also followed by eggs. And in China, shrimp was identified as one of the most prevalent allergens. One of the key aspects of the study was that food allergies are increasing globally, and China, Canada, Spain, US, and the UK are the top 5 countries with the highest percentages. I will now dive deep into the mechanism of IgE-mediated allergies. There are 4 stages in the overall process. The first stage is first exposure, which is when an individual eats a food that they're allergic to, such as peanuts, milk, eggs, etc., for the first time, and their immune system creates a special antibody called IgE against it. The second part is sensitization. These IgE antibodies attach to cells in your body called mast cells, which are part of your immune system. The third stage is next exposure. The next time you eat the food, the IgE antibodies recognize it and trigger those mast cells to release chemicals like histamine. The final stage is allergic reaction. This causes symptoms like hives or skin rashes, vomiting or diarrhea, and in some severe cases anaphylaxis, which is a life-threatening reaction that needs immediate medical attention. In a nutshell, the immune system acts as a security alarm, mistakenly treating harmless foods as a threat and triggering an allergic reaction. This slide represents the symptoms observed due to IgE-mediated food allergies. I'm not going to go into details of this, however, it is important to note that IgE-mediated allergies could impact several organs and systems of the body, starting from neurological to gastrointestinal. Let me now jump into the treatment protocol for IgE-mediated allergies. For mild to moderate reactions, oral antihistamines such as Benadryl and Zyrtec work the best. For severe symptoms such as anaphylaxis, epinephrine, also known as EpiPens, need to be injected, and then 911 needs to be called. Once the condition is under control, it is important to initiate the follow-up care, such as confirmation of the allergen, by using a skin prick test or blood test for IgE. It is also important to always carry antihistamines and an EpiPen in case of use. For long-term management, avoid the trigger food completely, and other therapies such as OIT and Xolair injections would be useful. Let me now go into the details of OIT. Oral immunotherapy is a treatment where people are given tiny, gradually increasing amounts of the food they're allergic to under medical supervision. The goal is to train the immune system to stop overreacting so small amounts of the food can be eaten safely. The risks involved with the treatment could lead to upset stomach, hives, or anaphylaxis. It needs daily dosing of the allergen every day and is not suitable for everyone. On the other hand, Xolair injections target and block IgE antibodies and stop the release of histamine from mast cells. It also mitigates the allergic reaction completely. It is a subcutaneous injection and needs to be administered every 2 to 4 weeks. This slide summarizes the clinical trial summary on OIT versus Xolair injections. It is notable from the slide that OIT studies are significantly more than Xolair injections, which is seen with the stat 729 versus 244. Also, significant numbers of studies have been completed for both these therapies, and lastly, the patient recruitment activities are much higher for OIT as compared to Xolair, seen by the stat 174 to 20. In conclusion, here are some key takeaways. Food allergies are a growing health concern. IgE-mediated food allergies can cause life-threatening reactions. OIT and biologics such as Xolair are emerging treatments. Education, early diagnosis, and emergency preparedness are critical measures. For future work, I would like to thoroughly assess the clinical trial data for OIT and Xolair injections. I would also like to evaluate both of the studies that are I would also like to evaluate results of the studies that are a combination of both. And finally, I would like to conduct literature search on articles related to gene therapy and food allergies. Here are the key selected references that I used for this presentation. I would like to acknowledge JHU and GHLC to give me this opportunity, and would like to acknowledge Eastlyme High School and Mrs. Hilt and Mr. Hernandez for their constant support. Thank you so much for giving my presentation your time. And here is my contact information in case there are any questions.